Kia ora koutou katoa. Today we're going to talk about medicines budgets and having an actual line item appropriation so that it's a budget that we can track and follow over time. New Zealand's well regarded by outfits like Transparency International and global financial institutions like the World Bank for the good governance and the strong financial management practices we have. The Public Finance Act that we have has replaced an all kind of input-based, here's some money, go spend it approach to, here are some resources, but we're really focusing on the performance and the delivery. And that allows for a lot more accountability and transparency. So big ticket items get listed out into what's called appropriations. That way Parliament can keep an eye on them over time. So because of the number of actors involved in setting a medicines budget, you've got 20 DHBs, PharmAg, the Ministry of Health, the Treasury, and a number of ministers involved. It's not always easy to follow how that's being set. Another thing is that you've got changes of definitions that happen from time to time, so that can affect what's included in the budget, whether vaccines are in or out, or things like nicotine patches are in or out. It can maybe go up and down or stay in the same. It's hard to know unless you really have a clear idea of what's in that scope of appropriation. A third important characteristic is that you've got different rates of innovation throughout the health system. So some areas are pretty much steady as you go, stable, where there's other areas where there's a lot more opportunity to adopt new practices or technologies. And again, it's useful to know what that underlying dynamic is so you can see that you're making the right sort of allocations and investments across the system. We already have line item appropriations for things like elective surgery and screening programs. And because medicines is about a $1 billion expenditure item, it definitely is a good candidate for being an appropriation. There's more detail on this in the New Generations Medicine Policy discussion document, and also there's a specific briefing note we've done on this topic on medicines appropriation for you to have a look at in the documents section of the consultation website. So see what you think. Noho ora mai.